Have you or someone that you know experienced a fishy-like odor in your vagina? If that is you, then this video is for you, because in this video, I'm going to talk about a condition that is known to be one of the leading causes of a fishy-like smell in the vagina. So stay tuned to find out what this condition is and what are some of the steps that you can take to prevent it. By providing information that is backed by data and that is backed by science. Hi everyone, if you are new to my channel, my name is Tandy. I'm a medical scientist and I make the findings of medical research accessible and usable to you. And in today's video, I want to talk about a condition known as bacterial vaginosis, or otherwise known as BV, or otherwise known as vaginitis. So before we get into it, we first need to know what bacterial vaginosis is, right? You know how your body has microorganisms. You have viruses, you have bacteria, you have protozoa, you have fungi, etc., etc. And essentially all of these are collectively called the microbiota, right? It's the microbiota in your body. So the same thing goes for your vagina. Your vagina has microorganisms in it. And in today's topic, we're going to focus more on the bacteria in the vagina. So the vagina has the good and the bad or harmful bacteria. And the good bacteria, what it primarily does is it keeps the vagina healthy by keeping the pH in the vagina low or acidic. It also keeps the vagina healthy by making sure that there's no overgrowth of harmful bacteria, but also overgrowth of other harmful microorganisms generally in the vagina. But now, when you have bacterial vaginosis, what happens is there's an overgrowth of certain species of harmful bacteria. I don't think it's important for me to mention what these species are for this video, but essentially what you need to know is that there's an overgrowth of these harmful species in the vagina. And this overgrowth essentially is what has been believed to cause bacterial vaginosis. So now you may wonder, okay, fine. So then what causes the overgrowth of the harmful bacteria? And there are many factors so far that have been shown to cause an overgrowth of this harmful bacteria, including having multiple sexual partners, right? Because if you have multiple sexual partners, what they do is they can introduce certain bacterial species that your vagina does not need. And this can end up causing problems for you, health issues for you, including bacterial vaginosis. Another one is if your partner has multiple sexual partners. That's also not a good thing because, again, they can also introduce certain bacteria that your vagina is not used to. Another important one is if you don't use condoms. The lack of condom use also, it contributes to all of this because, again, you're going in raw and introducing all types of things into your genitals, okay? So if you're also someone who douches, if you tries to go all the way up in there to wash it, that's not something you should do because this can disrupt the balance in the vagina. So you should not douche, you should not put anything in there because your vagina is self-cleaning. And douching is one of the things that can cause bacterial vaginosis. Another factor is using certain contraceptives, particularly the intrauterine device. The IUD has been commonly associated with BV as well. So yeah, if you're on it, pay attention to your health, to your vaginal health, and see how things are, because usually it has been linked with BV as well. And it's important to know that you can also have bacterial vaginosis if you're not sexually active, but the chances of you getting this condition when you're not sexually active are much less. They're much lower than for someone who is sexually active. So now you might want to know, especially if you're living in South Africa, why should I know about bacterial vaginosis? Well, for many reasons. For one, BV is prevalent in South Africa. It's actually believed that in the entire continent, South Africa is leading with BV numbers. There's more women here that have BV than in any other country on the African continent. In a study that was done in Durban in 2020, they showed that 49.4% of the women that were in the study were BV positive. So yeah, it's quite a prevalent illness. And the thing that makes it worse is that in approximately half of the women that have BV, they tend to be asymptomatic. So they don't have any symptoms of bacterial vaginosis. So yeah, that 49.4% was also, it was an underestimate because they probably couldn't pick it up in the other women, you know? So yeah, it is something that you need to keep in mind. There are certain symptoms that go with BV. As mentioned, one of the common ones is having a fishy-like smell in your vagina. I know that the vagina has its own smell, but it's typically not meant to be fishy. So it shouldn't, especially if the fishiness of it is accompanied by other symptoms, then that usually is a sign that there's something wrong. And some of the other symptoms that would accompany a fishy odor in your vagina would include if you have like a thin, whitish or gray like vaginal discharge, that can be an indication that you have bacterial vaginosis. If you have pain or irritation in that area, that like in your vagina, that can be an indication that you have bacterial vaginosis. If you have burning, like it burns when you pee, you know, that can also indicate that you might have bacterial vaginosis. So I know that I said that BV is commonly found in women that are sexually active, but to date, it's not classified as an STD, right? It just has been linked with sexual activity because what researchers have seen is that usually during sex can change the bacterial environment in the vagina. And as a result, this can make BV associated bacterial species grow in numbers and therefore cause the condition. But to date, BV is not technically classified as a sexual transmitted infection or transmitted disease. Another reason why it's very important to know about BV is that the treatment options that we have for BV currently, which is mainly antibiotics in different forms, that treatment is fairly effective. And there's like researchers all over the world that are exploring other treatment options for BV. But the problem with this is that sometimes people are ashamed to actually go to a doctor and say, look, I have these symptoms, or look, my vagina smells funky and sometimes I have to scratch, you know, or as mentioned, sometimes you're asymptomatic. So when this happens is that you end up not getting treated for bacterial vaginosis. And that is when bacterial vaginosis becomes a problem. Because if it goes untreated, then it can have severe long-term sexual and reproductive complications. So some of these complications include spontaneous miscarriages. You could become infertile, can make it very hard for you to fall pregnant if you do decide to fall pregnant. Another one is that it can, in pregnant women, usually it can cause preterm delivery, right? You end up going into labor much earlier than we're supposed to. And when it comes to sexual issues, what BV does is it increases your chances of acquiring HIV and also increase your chance of acquiring other STIs, such as gonorrhea, chlamydia, herpes, and so on and so forth. So this is why you need to know about bacterial vaginosis, so that, you know, if you feel like something is not as it should be down there, seek help so that you can do something about it, and then it doesn't cause these severe preventable complications. I think, yeah, the important thing would be also to know what is it that you can do to reduce your risk or your chances of getting bacterial vaginosis. And yeah, there are a lot of things that you can do, right, that you have power to do. And that is to limit the number of sexual partners that you have. Number 2, use condoms, guys. As much as you can, as often as you can, use condoms. Use condoms. Another one, do not douche. As mentioned, your vagina is self-cleaning. You know, there's no need to put a lot of products up in there. You shouldn't try to wash it. It cleans itself. All you need to do is clean the outside of it. And usually warm water is sufficient to clean it. Like, it has its own smell. You know, as long as that smell is not Like if it's like your usual smell that you know you've known since you were a child, it's most likely the right smell. You know, it doesn't smell like fresh flowers, yes, but it shouldn't be perfumed either. You shouldn't use all these products that promise that they'll make your vagina smell nice and fresh. That it shouldn't be smelling like that, because all these things, they lead to complications for you that you do not need. So yeah, do not do that. One other thing is wear breathable underwear. Wear underwear that allows your punani to breathe, to be fresh, to be cool. So yeah, do more of that. You know, if you can, go commando. Like I have a friend of my mom's who who loves going commando, and she talks about it openly, like, ugh, I'm not wearing any underwear. And I'm just like, good for you, girl. So yeah, you know, as much as you can, just let the baby breathe, because we need her. You know, she gives us quite a lot, and a lot of pleasure at that. And you know, another one that has been mentioned is like wipe from the front to the back and not the other way around, because if you wipe from the back to the front, you're introducing bacteria from your anus into your vagina, right? And like doing this also causes other infections like UTIs and whatnot. So wipe from the front to the back. I know it sounds so simple, but you'd be shocked how many people do things that just don't make sense. So wipe from the front, from the front to the back of your vagina. I mean, to the back of the anus, or to your anus, always and all the time. So yeah, that is essentially what I wanted to cover around bacterial vaginosis. There's so much more around it. There's so much research that's done on it that is very fascinating, that also raises some eyebrows. As a medical researcher, yeah, it's just like there are things, there's so much work that's been done on it and around it, but I wanted to bring that, like some of what's been done or what we know already, to you, so that you can use the information to make good decisions, to make sure that you live a long and healthy life that has very minimal issues as much as you can. So guys, thank you so much for getting to the end of my video. If you know that this video can benefit someone that you know, if you have sisters, if you have friends, you know, sometimes we do smell some fishy odor sometimes when someone stands up, and like, don't shame them. If anything, refer them to this video and say, look, I found out about this, how interesting. And that person maybe can learn something for themselves and do something for themselves. So yeah, thanks again to the end of my video, guys. I will see you on the next video. Bye. Please note that all the information that will be provided on this channel is for educational purposes only and not intended to be a substitute for medical advice. So if you have any specific or general medical concerns, please make sure to consult with your medical doctor.